Good evening, everyone. Namaskara, and welcome to the 13th episode of C4C Conversations. I am Tasneem Jiruwala, member of C4C and your host for today's program. So let's begin. Each of the previous episodes of C4C Conversation has been on very interesting topics ranging from the history of Namma Bengaluru, waste segregation, respiratory health, e-governance services from the government of Karnataka, animal welfare, heart health, BBMP and citizens, heal your body, mind and soul, COVID and children, and the last program, which was on the 4th of July, was regarding grow your own food. Today's program has a lot to do with a very important aspect of our lives. All of us know that life ends with death. But in death too, can we be of help to our fellow human beings? We help others generally with our knowledge, our efforts, our time, our money, etc. But on death, our body is cremated or buried. Can we, while living, decide on helping others upon our demise with our body's organs, which otherwise would anyway go waste? If yes, we need to know how to go about it and understand the entire process too. To enlighten us on this highest form of service to humankind, we have with us Dr. Suresh Raghavaiah, an organ transplant surgeon from Apollo Hospitals. So now, before we begin, as always, Rajkumar Dugar, founder and convener of Citizens for Citizens, will give us an overview and an update of C4C activities. Over to you, Raj.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ ಮತ್ತೆ ಸುಸ್ವಾಗತ. With today's program, we are entering the second year of C4C Conversations. For those who are not aware, Citizens for Citizens or C4C is just over 2 years old. And we are a group of citizens from across Bangalore who are concerned and passionate about leaving our surroundings a little better than we found it. Our focus has been on traffic and public transport, afforestation, and many civic issues. In this regard, we also work closely with BBMP, BESCOM, BWSSP, Traffic Police, Law and Order Police, BMTC, BMRCL, Railways, to name a few agencies. Let me give you brief updates about C4C activities in the past 2 months. On 8th July, on our Koti Vriksha Sainya platform, land preparation at Sir M. Vishweshwaraya terminal for tree planting started. Railways have given us 1 acre land in this station campus for tree planting. This station is one of the best in the country and is awaiting inauguration. On 15th July, C4C member Ashwin came across a scooterist, one Mr. Rajesh from Malleshwaram, who had skidded while turning from Cunningham Road to Palace Road due to loose gravel and fine particles left by Smart City work. C4C quickly coordinated and ensured the victim was not left alone. We spoke to Smart City officials and traffic police officials and took the victim to Mahavir Jain Hospital for treatment. Subsequently, the victim pleaded to be compensated for expenses on account of his injuries and damages to his scooter. We pursued the matter with the officials and ensured the victim received the compensation he was satisfied with. Mr. Rajesh expressed his deep gratitude to C4C for all the help. Based on C4C request, Smart City officials removed 2 of the 4 bus shelters on Palace Road outside Mount Carmel College. On 22nd July, Divisional Railway Manager Ashokji Verma, along with Rotary Midtown members, inaugurated tree planting at Sir M.V. Terminal, facilitated by Koti Vriksha Sainya. Planting of 2,417 saplings here has been completed. DRM Ashokji also visited Nammakadu, a dense urban forest near Cantonment Railway Station on railway land, and expressed his happiness at the growth of the trees and the maintenance. On 27th July, Koti Vriksha Sainya decided to plant 75,000 saplings all across Bengaluru to mark the 75th independence year. C4C started August with a cycle through your ward program on the morning of 1st August with 27 riders, young and old, male and female. We covered about 10 kilometers in about 55 minutes. On 6th August, we highlighted obstruction to pedestrian movement on the footpath opposite to Mount Carmel College. These obstructions were removed within a fortnight. On 14th August, inaugural planting of KVS's 75,000 tree planting program was organized at Freedom Park. BBMP Chief Commissioner Gaurav Gupta and other senior BBMP officials attended. In several constituencies, the concerned MLAs heartily participated with citizens to inaugurate tree planting. These planting activities are continuing right now. On Independence Day, 15th August, Southwestern Railways felicitated C4C for proactively helping them with oxygen concentrators when they had severe oxygen shortage in their hospital during the second wave. C4C quickly arranged 6 oxygen concentrators when SWR was having a nightmarish time due to death of several patients on account of oxygen shortage. On 18th August, we discussed several matters pertaining to Namma Metro with the new BMRCL MD, Shri Anjum Parvez. He assured to look into all the points raised by us. On 22nd August, C4C's Ajay Tandon telephonically called all C4C members across Bangalore and inquired about their well-being. This is the second such exercise this year and the fourth in 2 years. Recently on 26th August, one Mr. Anil Kumar, who is afflicted with severe muscular dystrophy and cannot move, sent a request on C4C's Facebook page for help with his second dose of vaccine. So our member Rakesh Singh, who lives near Anil Kumar's residence in Banaswadi area, was provided the details and he arranged for vaccination at Anil Kumar's residence itself on 28th August, leaving him pleasantly surprised. We rounded up August with a joint survey with BMTC for a feeder service between Mount Carmel College and Cubbon Park Metro Station. Now, during all these days, C4C continued to share authentic official information regarding COVID and other notifications. We are also helping people with vaccinations and RT-PCR testing almost on a daily basis. We continue to participate in all ward committee meetings. We are closely interacting with the team which is installing smart LED street lights in Vasant Nagar ward as a pilot for the entire city, and we are highlighting the corrective actions needed. Well, this has been a brief update of C4C activities during the last approximately 2 months. Dhanyavadagalu.
Thank you so much, Raj. That is such wonderful work being done, and it is heartening to know that C4C is doing such amazing work. Thank you once again. Now, it is indeed my pleasure to introduce Dr. Suresh Raghavaiah, our speaker for today. Dr. Suresh Raghavaiah is a liver and pancreas specialist and a multi-organ transplant surgeon trained at the prestigious Mayo Clinic in Rochester, USA. He studied for his MBBS degree from Adi Chunchunagiri Medical College, and after his general surgical training from St. John's Medical College, Bangalore, he completed a minimally invasive hepatopancreatic biliary or HPB surgical fellowship from LMM Paris. He went on to do a postdoctoral research fellowship in transplant immunology from Mayo Graduate School and was thereafter selected to complete the abdominal multi-organ transplant fellowship at Mayo Clinic. After returning to India, he was instrumental in setting up the HPB and liver transplant unit at the Dayanand Medical College, Ludhiana, and thereafter led the HPB and multi-organ transplant team at BGS Global Hospital, Bangalore, which is credited with having performed the maximum number of liver transplants in Karnataka. His team has also performed the maximum number of pancreas transplants in the state and the third highest in India. Dr. Suresh Raghavaiah is currently at Apollo Hospitals, Bangalore as a multi-organ transplant surgeon with expertise in liver, kidney, and pancreas transplantation. His special interest is in the surgery of the liver and pancreas. Something about Dr. Suresh. Dr. Suresh is originally from Kolar. His wife, Dr. Seema, is a dermatologist and they have 2 children. I must add that Dr. Suresh is a multifaceted personality with passionate interest in agriculture and engineering too. This is indeed a very rare combination. Now I request Dr. Suresh to enlighten us regarding the various aspects of organ donation. Please welcome Dr. Suresh. Over to you, Dr. Suresh.
Good evening, everyone. I hope I'm visible.
Yes, you are.
Okay. First of all, thank you, Mr. Rajkumar and Tashni, for such a glorious introduction. And thank you, Citizens for giving me this opportunity to actually talk about a subject which is very close to my heart. Being an organ donor advocate, how much ever you do to promote organ donation is less. So I'm hoping to reach a larger audience through this forum and hopefully enlighten about why organ donation is in such a poor state in our country right now. And if it's okay, I'm going to start the presentation right away. Right, good evening to everyone who is listening, and welcome to the session about organ donation. I hope to enlighten everybody on why it is important for us to pledge our organs after death, what the process is, and what are the roadblocks involved in actually people donating the organs. I have no disclosures related to the presentation, and I must say it couldn't have been a better day to promote organ donation than Ganesh Chaturthi. Historically speaking, he's the first transplant recipient, by the way, and we would not have any Ganesh Chaturthi to celebrate if at all the elephant had not, graciously donated the head. So that's the importance of organ donation. So just to give you a brief overview of my talk today, we'll talk about what the problems facing organ recipients are who are waiting for receiving an organ. We'll run through the concept of the waiting list. We'll talk about how you can register to be an organ donor, what the process involved during organ donation is, and at the end of the session, I'll be very happy to take any of your questions. So just to set the stage, on October 29th of 2018, one of a Boeing 737 MAX aeroplane crashed into the Java Sea. It killed all 189 passengers and the crew on board. 6 months later, it repeated again. In March 2019, another Boeing 737 MAX passenger airline crashed, and it killed, unfortunately, all the 157 people abroad. Now, immediately, what was the action taken? 51 different regulators grounded the plane. And by March 18, 2019, that is within 5 days of the accident happening, all the 387 737 aircrafts were grounded. And it initiated a massive investigation, both by the US Congress, UK Congress, and Canadian Congress. Lots of interdepartmental meetings happened, including the transportation departments, the FBI, the NTSB. Everybody came in to establish what exactly happened. They formed crash go-to teams and working groups to find out what exactly had happened. And they formed investigative parties and they talked among each other, and all the governments were talking with each other to find out what exactly had caused the crash. So after months of decoding all the flight data recordings, analyzing the cockpit voice recordings, and taking into account all the eyewitness accounts, they found out a fault with a particular system called as a maneuvering characteristics augmentation system, or MCAS. As soon as that was found out, they suspended the production of all the 737 Boeing jets. The chairman of Boeing had to resign and had to be replaced by a second person. Then once all the troubleshooting had happened, they started resuming the Boeing building again at a very gradual pace under oversight by the FAA of the US. So basically, for 1.5 years, the entire airline was not allowed to fly because it was the cause of 350 deaths. Now, if all of you are wondering why the hell am I talking about all these flight crashes, let me just put this into perspective. In India, around 4 lakh people die every year due to the unavailability of organs. Okay. So to put that into perspective about Boeing aircraft, we have 2,000 Boeing aircrafts being crashed every year, which translates into 166 Boeing aircrafts every month, or 5.5 Boeings every day are crashing and killing people. So if you look at it per hour statistics, in India, 46 people are dying every hour for want of an organ. And yet, despite all these deaths happening, we are very, very far from finding a solution. So let's talk about simple donation, eye donation, which I'm sure everybody is aware of because of Aishwarya Rai. In India, more than 2 lakh eyes need to be donated every year so that we can help all those visually impaired people who need to see. But only 1/4 of this is being met right now. Only 50,000 corneas are being donated in India every year. And remember that 150,000 people who are visually impaired add on to the next year. 500,000 people, or the 5 lakh people, need an organ transplant every year. Okay, meaning if you put them all into Boeing jets, you can fill up about 600 Boeing jets and crash them. And that is the statistics, poor statistics when it comes to India and organ transplant. So look at what we are, where we are at. So if you look at the kidney transplant patients, we need to do 2 lakh kidney transplants a year to kind of help all the patients with renal failure. But what are we doing? We are transplanting only about 6,000 patients. If you look at heart transplants, we need to do 50,000 heart transplants, but we are hardly doing 15 to 20 per year. And if you look at liver transplants, we need to do 30,000 liver transplants a year to maintain healthy population in India. And we are hardly reaching 1,500. So this is the dismal state of affairs and a very unfortunate truth for recipients who are waiting on the waiting list, hoping to get an organ so that they can lead a healthy life. Now, why does this happen? Why is there such a shortage of organs? Is it because Indians don't want to donate? Well, this is an interesting statistics. So one of the companies, they called up random people from 28 different countries, asking people if they were willing to donate. Okay, so this is a company called Statista in the US. So of the 28 countries they called up, India was number 1 in saying yes to everybody. They said all the people polled, 75% of the people said they have no hesitancy in donating their organs. Okay, and they ranked India at number 1 on where people are most willing to donate. So given this statistic, where do we think we stand in the world donation rate? Do we think we stand in the top 25? Unfortunately, no. We are nowhere close to being in the top 25. So do you think we're in the top 45? Unfortunately, no. We are not even in the top 45 when it comes to organ donations across the world. Now, why do we think this is? I don't know why this is. So this is the Times of India poll. Okay, so they did a poll, polling all Indians all over India, and they came to this conclusion. 80% of the population polled was aware that organs can be donated. 70% of them thought that yes, organ donation is important. 35% were aware of what the process involved in organ donation is. 25% were definitely willing to donate organs. But when it came to actually doing it, how many of them registered? 3% registered. Okay. So after seeing this poll, I was very happy that most Indians are like me, that we say yes to everything, but when it actually comes to doing, we actually do very less. And this does not apply to C4C, by the way. I just heard their accomplishments and I'm quite blown away by how much they are doing to help Bangalore. So less than 3% of the population, after the 80% of the people who are willing and aware of organ donation, only 3% of them registered to actually going to do organ donations. So now, why is that? Why is it such a difficult proposition that people who are aware of organ donation, who know how to donate, who are aware of the process, do not register? So going through literature, two things always come into picture, especially when it comes to the Indian scenario. Lack of awareness and knowledge about the concept of organ donation, which we know that 80% of them are aware. So what are we talking about? Lack of awareness. It is the concept of brain death. We will just talk about what brain death means for organ donation in a moment. And the second thing is, especially in India, there's a lot of myths and superstitions and misbeliefs regarding organ donation in India. So now let's talk about the concept of brain death. Now, when it comes to brain death, the lack of awareness, unfortunately, is not just limited to the public. In my 20 years or so in the field of organ transplantation and as a donor advocate, I've come to know that most medical personnel are also unaware of the concept of brain death and the possibilities of organ donation. So we go from hospital to hospital holding these camps to promote organ donation in association with SOTO. We'll talk about what SOTO is. But when we go to these different hospitals and try to talk to the medical personnel about what brain death is, how to diagnose brain death, what the possibilities for organ donation is, even we are quite surprised at how ill-informed our medical personnel are as well. So forget the public. So whenever we talk about 80% awareness, you can be aware of organ donation. But if you're not aware of the concept of brain death, or your family is not aware of the concept of brain death, generally we find it very difficult to convert or consent the family towards organ donation. So let's just in a brief moment look at what brain death is. So brain death is when a person who's already on an artificial life support machine no longer has any brain function, meaning the brain has become non-functional. So what does this mean? This means that they will not be able to regain consciousness or be able to breathe without the support. So in short, if you want to say, it is a complete loss of brain function which is necessary to sustain life. Now, the most common question we get asked in this time, is it coma? Is brain death coma? No, it is not simple coma. So what do we mean by coma? In coma, the patient is definitely unconscious, but the patient is breathing on his own. His heartbeat, BP, respiration, all of his other systems are normal. And if we support this patient for long enough time, there is a chance that the brain function will recover. But when we talk about brain death, all the centers in the brain which are controlling the above functions, all the functions which are breathing, the BP, the heart rate, the rest of the bodily functions, the brain is the master key. All of these are completely and irreversibly damaged. Okay. So now let's look at what the causes of brain death are. The most common causes of brain death is head trauma. And in our practice, in medical practice, the most commonest cause for a head trauma is obviously a road traffic accident. We have a lot of youngsters driving these high-end bikes right now, doing drag racing and everything. And unfortunately, unfortunate people who don't wear helmets have a fall and they suffer very significant head trauma. So at that time, what happens? All the brain centers which control the breathing, the heart rate and everything get totally damaged. And when they come to the hospital, they are kept alive by artificial means. They put a ventilator to control his breathing. They start medications to maintain his heart rate. They start medications to control his blood pressure. They start medications to kind of manage his kidney functions. So all the main centers are gone. And sometimes we do have unfortunate people, especially with all the metro construction which had happened. We did have people falling down and hurting their head and having brain death. Now, sometimes, unfortunately, patients may have intracranial aneurysms. They bleed inside the brain to such an extent that the brain becomes non-functional. In older people, patients can have stroke, which affects the vital areas of these brains, or sometimes some infections are there, which affect the vital, and very rarely, some brain tumors can also occur, which will affect these centers. So now, how do we make sure that the patient is just not in a coma and has a reasonable chance of recovery versus the patient is brain dead? How do we do this? So there is an international protocol laid out, whether it is India, Sri Lanka, Bahrain, US, Europe, the same protocol is laid down for testing brain death. So basically, two different tests are done, two different sets of tests are done 6 hours apart to make sure that the brain has actually become non-functional and not just a temporary phenomena. So how is it done? Usually what happens is two different teams come and test the brain death. So you have two physicians or two doctors who come and make sure to test that the patient is actually brain dead. Now, why does this happen? Because one doctor might miss a finding or he might overread a finding. So in order to stop that bias, we have two different people coming and checking for brain death. Now, the second rule is the doctor who is actually treating the patient cannot check for brain death because he might have some emotional attachment or some other confounding factor which might cause him to give a wrong report. So that is why a doctor who's treating the patient never ever tests for brain death. So two independent sets of doctors come, they test for brain death, and sometimes we call a doctor from an outside hospital to come and actually test for brain death to make sure that the patient is actually brain dead and he has absolutely no hope for recovery. So once the brain death has been declared, that is when, so you can see the last part over here is, that is when they refer to a transplant team. So remember that the transplant team is nowhere involved in diagnosing brain death unless brain death has been completely certified by two different people, by two different tests which have done 6 hours apart, and only then do we even consider broaching the subject of organ donation to the family. Now, the problem here is this is the biggest roadblock when it comes to organ donation, because when you look at a brain dead patient, at least for about 48 hours time, all of his other organ systems will be functioning. His heart will be beating, his kidneys are functioning, his BP will be thing, although he might not be breathing, but at that time he's already on a ventilator. So obviously the breathing movements are absolutely being seen. And generally it becomes very difficult for the family to come to terms with the fact that their loved one is no more. And especially after seeing the breathing movements, his heart is beating, his BP is fine, he's making urine, it becomes very difficult for families to come to terms with this fact. And this is the term in medical thing we would say the lack of awareness. So it is not about lack of awareness of organ donation. Everybody is aware that their organs can be donated. 80% of India is aware that the organs can be donated. But what we normally see is lack of awareness of the concept of brain death. And like I said, we go to different hospitals. We try to tell the ICU people, we try to counsel all the doctors to check for brain death. And this is the biggest roadblock we hit in terms of organ donation. So the government of India has also taken a lot of proactive steps to actually increase awareness about brain death. So we get routine newspaper articles talking about brain death, and even the Supreme Court and the government and the NATO has actually laid down rules about what to do in case the patient has been declared brain death. Okay, so if you look at over here, once brain death is confirmed, the ventilator support of the patient can be removed. Okay, meaning the patient is legally dead. So you do not need to keep him artificially alive by keeping him on a ventilator. So medical practitioners should have a talk with the patient's family saying that the brain stem is dead and he is no longer more. Okay, here again the government said to declare a patient brain dead, a panel of doctors must perform prescribed tests twice with a minimum interval of 6 hours. And lastly, it says if criteria for brainstem death are met, panel must declare the patient dead, even though the heart is beating, even though the BP is okay, even though his organ systems might be functioning. Remember, these are all artificial thing because you're giving a lot of medications to actually keep that functioning. And what makes a person, it's not the body, it's the brain, it's the way he talks, it's the way he interacts with people. And once that is gone, you can no longer keep him alive. And over here, it says all treatments, including cardiorespiratory support, must be discontinued. But imagine in India, if you did this, we would actually get hit by the patient's relatives that how dare you discontinue treatment? He is not dead. His heart is beating, his BP is okay. So this is the biggest roadblock we as physicians face when actually talking about brain death and the concept of organ donation after brain death to the family. Okay. Now let's look at the second roadblock we get with respect to organ donation. Now in our careers, I'm sure most physicians, most transplant physicians treat patients of all religions and faiths. Okay. So let's say that the patient has been declared brain death. The family has come to terms that the loved one is no more. And we broach the subject of organ donation. Now, the first thing they usually throw at the treating team is that my religion prevents organ donation. And we've had this excuse more than 20 times till now in people or in patients' families who are hesitant about organ donation. Okay. But day in and day out, various organizations bring together religious leaders of various faiths. And this was done for the National Organ Donation Day by NATO. NATO is a National Organ and Tissue Transplant Organization. It is under the aegis of the Health Ministry. It is a central government organization which is looking to promote organ donation and which is in charge of the entire transplant process in India. So what they did, they invited Islamic, Buddhist, Hindu, and Christian religious leaders to come together to actually discuss, does religion actually prevent organ donation? Every religious leader, be it Hindu, Christian, Muslim, or Buddhist, everybody said their religion absolutely promotes organ donation. There is nothing written in the scriptures or the Bible or the Quran or Buddhism which says that you cannot donate organs after your death. And in fact, everybody gave references in their holy books where God actually says that it is good to donate organs after your death. So obviously, this no longer holds good. There is absolutely no reference anywhere that any religion prevents organ donation. Now let us look at a second myth. What if I recover from brain death? And this is the biggest question and the most common question which the family asks. Sir, ಇವ್ರಿಗೆ ಗೊತ್ತು brain death ಆಗಿದೆ ಅಂತ ಮತ್ತೆ improve ಆಗೋದಿಲ್ವಾ? Okay. So in all the donations all over the world, the brain death diagnosis has been purified to such an extent that once a brain death has been declared, there has been not even a single case where a patient has woken up from brain death. Okay, it does not happen. The standards to determine if a patient is brain death are very strict. Okay, and generally if a patient agrees to donate his organs, we doubly make sure that the patient is actually brain dead and there is absolutely no hope for recovery from brain death. Now the third one they ask, sir, if at all I became an organ donor and they come to know ICU doctors that I'm an organ donor, they will not work hard to save me. Again, this is absolutely does not hold good because the ICU treating doctor's team job is to save you. Okay, when a patient comes to a hospital, our complete energy and this one vitality goes towards treating and helping the patient. Okay, and this is the main reason why a treating doctor is never involved in declaring the patient brain death or counseling the family towards organ donation. Why? There should not be that conflict of interest in the treating doctor's mind that if he's an organ donor, he can go ahead and help 8 lives. No, that will never be the thought in the doctor's mind. If you came to the hospital with a head injury, the first point will be to save you, make sure you get better, and only after all attempts have been futile and you've been declared brain death is only when the entire team will actually think even of approaching your family for organ donation. Now, one of the other things which we get is, okay, sir, opkontive organs ella kodlike, but full scar banbidutte, adna id madakagala. So most people want to hold an open casket funeral as well. So they think that when you do an organ donation, it mutilates the body. The answer is again no, because we do a very clean surgery in order to procure all the organs. And once the organs have been retrieved, we close it in such a way that it gives a very neat closure. And we also cover the donor's body with cloth so that none of the incisions or all the marks we make on the body are visible. And even when it comes to eye donation, after the eyes are removed, we usually insert an artificial eyes so that it looks as natural as possible. So no, even after organ donation, you can have an open casket funeral. We do not mutilate the body. We treat the body with respect and make sure that the donor family is not led to any kind of a discomfort or difficulty in cremating or putting an end to their this one. Next, they think some of the donor families are, sir, ಇದಕ್ಕೆ ಖರ್ಚಾಗುತ್ತಾ organ donation ಮಾಡಿದ್ರೆ? Answer is absolutely no. A donor's family is never charged for donating the organs because they're doing such a noble gesture, and all hospitals across the world will never charge a single penny for donor's family for donating their organs. Now, the last one is, I am under age of 18. I'm too young to make a decision. Well, yes, this is partly true. But having said that, you can make a decision to donate your organs. Okay, but it is important, excuse me, it's important that you convey your wishes to your family that yes, you want to donate your organs. If by some unforeseen circumstances something very bad happened to me, that I would like to donate my organs to needy people and save a lot of people, and as long as your family is okay with it, it's absolutely fine for you to make a pledge for donating your organs. Okay, now the last thing which they ask, sir, naveno organs kortivi, neevella markontira. When awaiting a transplant, the rich and the famous get priority. The answer again is no. Remember that the hospital which retrieves your organs has no say into whom the organ goes. Okay, so this list is maintained by the government. The government of Karnataka has SOTO. SOTO is State Organ and Tissue Transplant Organization. So they have a waiting list of all the patients who have been registered for receiving an organ, and they will decide actually that who is the sickest, how long they have been waiting on the waiting list, who is the most deserving candidate, and it is them who actually determines whom the organ goes to. And there is no way a hospital which is coming to retrieve the organs has any say in saying it is going to this person, it is going to this person. So however rich you are, however celebrate your status is, none of these things matter when it comes to receiving the organs. Like I said, this entire thing is under the control of the government, and it cannot be changed. Any recipient anytime can file an RTI status and see if at all any of the recipients were skipped, or if at all any preferable condition or preferable allocation of the organs were done. So it's a very, very clean system. So one thing is, you do not have to worry about the organs getting misrepresented or misallocated, right? So now let's say that yes, you agreed that yes, I want to be an organ donor, I want to really go ahead with it. So what all organs can be donated? So we can change the life of 8 people. So the first of all, 1 heart can be donated for a person in need of a heart. Lungs can be donated. 1 liver can be donated, and usually if it is a healthy liver, we can split the liver into 2. Okay, 1 half of the liver goes to 1 patient and the other half goes to another patient. So you get 2, you can save 2 recipients by giving 1 liver. You can give 2 kidneys, 1 kidney to 1 patient, another kidney to another patient. You can give pancreas transfer. You can donate your pancreas for patients suffering from diabetes, and for some unfortunate patients where due to some mishap where they've lost their entire intestine and digestive power, the intestines can also be donated. So you can save 8 lives by pledging 1 patient pledging their organs. Now, not only the organs, you can pledge your tissues as well. Like what? You can donate eyes. Remember, if you donate eyes, you will help 2 people to see. You can donate your tendon and cartilages for unfortunate people who suffered injury. Let's say your heart is not fit for transplant, but there are a lot of patients suffering from different heart diseases which require surgery and heart valves. So you can donate your valves. You can donate your blood vessels. You can donate your skin. Now, skin is very important. Why? we have a lot of burns patients coming where the skin is completely burnt, and if you don't cover it with skin, they usually succumb to infections. So if you donate skin, you can easily save the life of that burn patient. Okay, you can donate your burns and you can donate stem cells. So if you look at it, you can do 8 life-saving organs. Okay, and with all these tissues, you can touch up to 75 lives can be improved. So this is the miracle of organ donation, that if you donate your organs, this is the number of lives you're going to improve on death. Now, let's say that for some reason you were not able to donate your organs to the living or help people, you can always donate your entire body to medical science. So there's a lot of research which happens upon organs and tissues which help the living in the near future. You can always donate your entire body to science after your death. You help the learn. In medicine, the first sentence that teaches us is the dead teach the living. So we need to do dissection. We need to see in the first year of MBBS, what we do is we dissect the human body. We get to see what the eyes is, where the heart is, where the liver is, where the spleen is, how the kidney is, and we study each organ. And nothing can match this. No number of online classes and no number of virtual reality classes can absolutely match learning on an actual human body. And we do dissect cadavers. So that's why the first thing they teach us in medicine as we enter medical school is the dead teach the living. And that's why in case you're not able to donate your organs, please do consider donating your body to medical science after your death. So now let's say you made a decision to donate organs. Congratulations and thank you for that. But how do you go about pledging your organs? There are multiple avenues, which is just like a snap of your finger, you can pledge your organs. If you're one of those people who are very computer savvy, you can do online registrations, or you can go to different organizations in person and pledge your organs. Okay. So the easiest way to pledge your organs is going to the website of SOTO. SOTO is State Organ and Tissue Transplant Organization. It was previously called as Jeeva Sarthakate. And this is the one which is under the aegis of Department of Health and Family Welfare and the government of Karnataka. The moment you land on their web page, you get a QR code scanner. You scan your code, you put in your name, phone number, your age, your sex, and all your other details and all your other organs you're willing to donate, and click send, and that's it. You pledged your organs. Or every possible hospital in Bangalore has a organ donation services, be it Vikram Hospital, Manipur Hospital, Sakra Hospital. Any hospital in Bangalore has an organ donation form which you can fill up online, and they will send you what is known as an organ donor card. So now you keep this organ donor card. What does it tell you? You consent or you pledged your organs to other people once your life is over. Now, if you want to do it in person, it's also easy. Again, Jeeva Sarthakate, if you go into the website, you get this form over here, which you fill up and just post it to them. And they, once they receive your thing, they will send you back your organ donor card. Now, in 2012 or so, the government really got involved with coming to organ donation. And that time our respected Anil Kumble, a cricketer, really spearheaded the concept of organ donation. And what happened is they convinced the government that anybody coming to seek a driver's license can actually get their license stamped as a potential organ donor. So they started putting stickers on the driver's license, which basically looks like this. So now any form you fill up or any online form you fill up for an organ donor, you get this one. Okay, you get, this is called as an organ donor card. Now you can carry this in your wallet. That will be the best thing possible. It's smaller than a credit card actually. It will fit very neatly into your wallet. So you can carry that along. Or if you go to the RTO, you can see over here, the government of India has instituted this. There is a small heart and it says over here, organ donor or simply OD. Now, what does this mean? This tells anybody in the event of something unfortunate happening to you and you are no longer alive, this gives us the peek into your wish, saying that you wanted to donate your organs after your death. And this will make it a lot easier for the medical team to approach your family towards organ donation, that this is what he wanted. And I think it is a moral responsibility of the family to actually go ahead with organ donation. Now in the US, this seal actually supersedes the family's wishes. Now let's say I was in the US, my license is stamped with the organ donation card, and something unfortunate happened to me. I had an accident, I fell, or I had a stroke, and I was declared brain death in the hospital. Now, if my license showed that I was an organ donor, the family cannot legally refuse organ donation. Okay. Like if at all my wife or my family said, no, I don't care what he wanted before his death, we are not willing to donate organs, that argument does not hold good in the US. Technically in India also that is there, but we have been chased down, beaten, abused in the worst possible languages possible when we actually went to ask the family for organ donation. Okay, so in India, that's still, this is where the awareness, has to improve, that the patient who actually, this was his dying wish and you need to donate organs. And, we got a long way to go for that one. So that is where this comes, the last myth. Having a donor card is all that's required to become a donor. The answer, especially in Indian scenarios, unfortunately, no. It is very important for you to discuss your wishes with your family, because unfortunately, in the event of something unfortunate happening to you, you are not going to be there to actually communicate your wishes. It is your family who needs to take the call on donating your organs. And this decision becomes a lot easier for them. Remember that it is the worst possible time to ask your family something. They will be grieving over the loss of a loved one. And at that time, somebody from the hospital goes and says, give us these organs. It is not an easy conversation to have, believe me. But if you have actually already, talked to your family about it, discussed your wishes with the family, saying that in case something unfortunate happens to me, and we need to donate organs, that conversation becomes a lot easier. So now let's say what happens during an organ donation. Let's say something unfortunate has happened to a patient. He has come, all hopes are lost, the brainstem death has been declared. What happens then? So the medical team will come and discuss with the family that unfortunately that he is no more, your loved one is no more, and we need to test for brain death. So if the family consents, then we go ahead with the brain death testing. And if the brain death is confirmed, we inform SOTO. SOTO is the State Organ and Tissue Transplantation Organization. So once SOTO is informed, they will come to the hospital, they will speak to your family, they will make sure that the family is okay with organ donation. They will get all their signatures and everything. And SOTO will go through the list of waiting people who are waiting for an organ, and they will allocate that particular organ to a particular hospital or a patient. And then that particular team will be called in to retrieve the organs over there. Okay. So how are we doing over the years? India did extremely well in 2016. Okay, so if you look at the numbers over here, we had 400 donations in 2014, 660 donations in 2015, and in 2016 we almost hit 1,000 donations. And this is for a population of 1.6 billion minded. Okay, but after 2016, it's kind of static. We've had anywhere between 700 to 800 donations until 2019. And please do not ask after 2019, because that's when the COVID pandemic happened. And unfortunately, the entire thing, came to a standstill. Now, let's look at what's happening in Karnataka, our region where we are situated. So as of August 1st, we had 118 patients waiting for a heart transplant. We have 22 patients waiting for heart and lungs. We have over 1,250 patients waiting for a liver transplant. We have 20 patients waiting for a liver and kidney. We have 3,800 patients awaiting a kidney transplant. 20 patients wanting a kidney and pancreas, 60 people wanting lungs, and 1 person needing a small bowel. Okay. Now, the thing with this is 3,800 people waiting for a kidney. So currently the waiting time for a kidney, if you unfortunately needed a transplant, is about 5 years. Okay, so if you register today for wanting a kidney, you're going to have to wait for 5 years before you can actually get a kidney. And you can imagine in that interim 5 years, how sick you can get. And that is where you end up losing a lot of patients on the waiting list. So how are we doing donation wise? Again, 2017, we had about 68 donations. 2018, we had about 90 donations. And 2019, we really picked up steam. We had 105 donations. And this is again largely because the government got involved and SOTO got involved, and we did a lot of organ donation drives, and we had 105 donations. And I think we need to remember over here, Mr. Harish. If you Google Mr. Harish's story, you'll know that created a lot of awareness for us. He was one person who was riding on a two-wheeler and got crushed by a four-wheeler on Nelmangla Road. He was almost cut in half. And in the last few minutes of his life, his only thing where people were recording him on the phone, he said, "Please donate my organs." That created a lot of awareness regarding organ donation. And actually the government of Karnataka instituted a fund in his name to actually given to the donor family. And more recently, we had a famous Kannada actor who actually unfortunately died because of a road traffic accident and ended up donating organs. And we got a lot of press coverage for that. And we actually got a lot of pledges for organs after his death. And this is, unfortunately, this is the kind of tragic events which need to happen to people to come forward. We always wait for a crisis or something sensational to happen before we come forward to pledge our organs. And that is the unfortunate thing with Indian population. Okay, so quickly, I'm just going to run through a couple of videos, okay, to make you guys understand what exactly, whom you're helping when it comes to organ donation. I hope it will be audible.
ನಮಸ್ಕಾರ, ನಾನು ಮೇಖಲಾ. ನನಗೆ ಡ್ಯುಯಲ್ ಆರ್ಗನ್ ಕಿಡ್ನಿ ಮತ್ತು ಪ್ಯಾನ್ಕ್ರಿಯಾಸ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆಗಿ ಈಗ ಸುಮಾರು 4 ವರ್ಷ ಆಗ್ತಾ ಇದೆ. ನನಗೆ ಚಿಕ್ಕ ವಯಸ್ಸಿನಿಂದ ಡಯಾಬಿಟಿಸ್ ಇತ್ತು. ಆದ ಕಾರಣದಿಂದ ಕಿಡ್ನಿ ಫೇಲ್ಯೂರ್ ಆಗಿ ಡಯಾಲಿಸಿಸ್ ಮಾಡಿಸ್ಕೊಳ್ಳುವಂಥ ಪರಿಸ್ಥಿತಿ ಬಂದಿತ್ತು. ಆಗ ಡಾಕ್ಟರ್ ಸಜೆಸ್ಟ್ ಮಾಡಿದ್ದು, ಈ ಥರ ಡ್ಯುಯಲ್ ಆರ್ಗನ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ನಾನು ನಾರ್ಮಲ್ ಲೈಫ್, ಹೆಲ್ದಿ ಲೈಫ್ ಲೀಡ್ ಮಾಡ್ಬೋದು ಅಂತ. ಸೊ ಅದರ ತಕ್ಕಂತೆ ನಾವು ರಿಜಿಸ್ಟರ್ ಮಾಡಿದ್ವಿ. ಹಾಗೆ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಎಲ್ಲ ಆಯಿತು. ಡಾಕ್ಟರ್ ಸುರೇಶ್ ರಾಘವಯ್ಯ ಅವರಿಗೆ ನನಗೆ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಸರ್ಜರಿ ಮಾಡಿದ್ದು. ಈಗ ನಾನು ತುಂಬ ಆರೋಗ್ಯವಾಗಿ ನಾರ್ಮಲ್ ಹೆಲ್ದಿ ಲೈಫ್ ಲೀಡ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆದಮೇಲೆ ನನ್ನ ಆರೋಗ್ಯ ತುಂಬ ಚೆನ್ನಾಗಾಯಿತು. ನಾನು ಕನ್ಸೀವ್ ಆದೆ. ಈಗ ನನಗೆ 3 ತಿಂಗಳು ಮಗು ಇದೆ. ಸೊ ಈ ಥರ ಲೈಫ್ ನನಗೆ ಸಿಕ್ಕಿದ್ದಕ್ಕೆ ಕಾರಣವಾದ ಆ ಡೋನರ್ ಹಾಗೂ ಅವರ ಫ್ಯಾಮಿಲಿಯವರಿಗೆ ನಾನು ಸದಾ ಚಿರಋಣಿಯಾಗಿರುತ್ತೇನೆ.
So my initial symptoms of falling sick and having kidney stones and such started off when I was just 5 years old. Back then there wasn't anything that helped us understand why I was forming stones, and equally my brother who's 3 years older to me, he has a similar problem. So both of us on and off fell sick. So we used to rush to the hospital, get the stones out. This happened for quite a long time. The kidney and the liver simultaneously, that is when you're getting rid of the complete issue. So this was explained very beautifully by my team, by the doctors, and then I was convinced, I was thoroughly convinced that yes, this is, at least there is a solution to this. And after that, I think I'm here. I'm so lucky to have this second chance at life, because somebody somewhere decided to donate, and I'm eternally grateful, because I don't get to meet the donor, but I think somewhere there the person would know that they have actually changed, touched a life. I've come back to my children, I've come back to my family, and nothing more could be beautiful. And that is when I realized that organ donation is such a beautiful thing. One soul can actually go on to change as many as 8 to 9 lives. If one person is going to decide to donate the organs instead of just burying them, I think nothing can be more fruitful than that. So it's a sincere appeal. Please go on to promote organ donation and go on to save lives.
This story, see, this is the thing what I talk about, sensationalism. You need to create such stuff to actually, be able to drive a point across. I request everybody to see this video. So this was the first person we heard the testimonial, Mekla, who was a double organ recipient and had a baby. So this was actually India's first double organ recipient, and we ended up being in the news for that because it's the first in India. And this is Kaustubh, who's India's first baby for a double organ recipient. And this is the kind of the beautiful things we can expect from transplant patients, if they do get the gift of life. Okay, and thank you very much. I'll be happy to stop here just by saying that, don't take your organs to heaven. Heaven knows we need them here. Thank you so much. And I'll be very happy to take any questions, please.
Tasneem, go ahead.
Thank you. Thank you so much, Dr. Suresh. That was an immensely informative and anecdotal awareness talk that you gave us. And after listening to you and learning from your talk today, I have understood so many aspects of organ donation that I didn't know about, especially the brain death, how to go about understanding that itself. So thank you so much.
Thank you so
and
much.
That thought itself gives me so much satisfaction that a good deed is being seriously contemplated. And so at this point, I'm sure it is very natural to have questions and to seek clarifications, more clarifications from you. So may I request Raj to kindly moderate the question and answer session? Raj?
Yeah, take up that. The first question is from Aparna Mahesh. Can a child suffering from cerebral palsy donate organs, especially eyes? She is she has written, she is a counseling psychologist herself.
Yeah, it is absolutely possible for any person to donate organs. So the very few conditions where we don't accept organs. So when the patient has a malignancy or a cancer and dies because of cancer, it's always a problem that if the cancer comes back into the recipient, that is not ideal. Having said that, there are certain cancers like brain tumors, which are very less potential to spread. And we can actually go ahead and procure organs from them. And this one, and cerebral palsy, absolutely. Any child suffering from cerebral palsy, in the event of the death, yes, they can donate their organs. Now, the second condition where they cannot donate organs is if they have any communicable diseases like HIV or hepatitis C or hepatitis B. Generally, they cannot donate organs. Having said that, right now, hepatitis B and hepatitis C have very good treatment. Not hepatitis B, hepatitis C especially has very good treatment facilities available, and patients suffering from hepatitis C, provided their organs are normal, can absolutely donate organs.
Aparna, is your question answered? Yeah, okay. Okay, next is...
Thank you so much. Yes, it is done.
Yeah.
Thank you very much.
Yeah. Thank you, Aparna.
Next question is from Tasneem herself. How important is the consent of the family for organ donation after death, not just for under 18? She's asking about above 18.
Yeah, so in the legal sense, it is not required. Okay, so once you've written in a, let's say you have a donor designated card, or in your driver's license, it says that you want to pledge your organs. In the legal sense, the family consent is not required. But in India, we are still very far from actually implementing this one. If you have not pledged your organs, then the next of kin is the one who is supposed to give consent for your organs. So let's say I do not have a donor card and something unfortunate happens to me. Then usually it's my wife. If I'm married, my wife becomes the power of attorney to give consent for organ donation. If my wife is not there, my kids become the power of attorney. If my kids are not there, my parents become the power of attorney. If my parents are not there, my brothers and sisters become the power. If they are also not there, then it goes to my grandfather and grandmother. So that's the hierarchy with which it goes. So usually if you are not donor designated or pledged your organs before your death, then yes, the family consent is absolutely mandatory for organ donation. But if you already pledged your organs, it is more of an emotional thing that the family needs to consent for the donation. Especially in India, because obviously, there'll always be a bunch of people. When something unfortunate happens, Indians have a problem of congregating. And this is again the most important roadblock, I would say, for organ donation. So usually what happens is the immediate family will consent. So brain death certification is done. The family has grieved. They have come to an acceptance that organ donation, the loved one is no more. And they come and say, yes, sir, let us go ahead with organ donation. Within about 6 hours, you'll have about 10-15 people who have come. Okay. And then the question starts getting raised. Illa yak beko kodalla navu namige en kodtira. So this is day-to-day scenario. Unfortunately, we see when it comes to organ donation, and this is the reason why it is very important for you to discuss your wishes with your family, that in case something unfortunate happens to me, I would like to donate my organs. And then, like I said, it becomes very easy for us to have a conversation with the family, and it becomes, at the same time, it becomes that much easier for the family to actually go ahead with organ donation.
Okay, the next question is from Kishore. Can families who have economical problems and wishing to donate after death receive economic benefits in lieu of organ donation?
Absolutely no, sir. Unfortunately, absolutely no, because an organ donation process has to be completely voluntary. It has to be for the greater good. Now, the moment you start offering economic benefits, it is a sale of an organ. It becomes unethical. It becomes a form of coercion. So this is where the money power will come into play. Now imagine a scenario, we allow this. Let's say the government allows that we are going to give you, let the recipient who's going to get the organ pay the donor some money. Then what happens? Bidding will start. I'll give you 2 lakhs, I'll give you 3 lakhs, give your organ to me. So no, unfortunately, no. Even from an economically weaker section, it has to come from the good of the heart. And this is where the family awareness, this is where creating awareness helps. Now, no, they do not receive any economic benefits for organ donation.
He has a supplementary. How transparent is organ donation, as there are reports of middlemen dealing with organ transplantation?
Okay, not with cadaver donation. Okay, yes, there are always bad apples, sir. Any profession, any service, anything will always have bad apples. And all this middleman thing you read about in the papers is more concerned with living donation. Where they get a thing and they ask them to donate 1 kidney. And yes, there have been bad reports of different hospitals coming under fire for all of this. But when it comes to cadaveric donation, nothing is under the control of anybody. The moment brain death has been declared, the government steps in, SOTO steps in and takes it forward. Like I said, none of the people have any say in saying to whom the organ is going to go. It's the government which has a list which is available on their website. Anybody can peruse it. You can file an RTI to see what exactly has happened to this one, and then you can do it.
There's a question from Arvind. Sir, I have read somewhere that animal organs have been used on human beings. Is it true?
Well, we have not at that state yet, sir. And so we do use animal tissues like heart valves and blood vessels and everything we use. But till now, research has not reached such a stage where we can safely transplant animal organs to humans yet. Lots of research is being done, lots of money being put into xenotransplant. So when we transplant animal organs to humans, it's called a xenotransplant. A lot of research is happening, especially to look at whether we can transplant pig kidneys to humans. So a lot of research is happening, but unfortunately, no, we have not reached such a stage yet where we can safely do it.
Okay.
But hopefully, God willing, if it happens, then I think all of us, we do not have to worry about getting an organ, which can happen very close to the future.
Oh, great. That's good news.
Yeah.
Tasneem asks one more. If a person has expressed his or her wishes to donate the body, but not registered, what should be done?
That's absolutely fine. So this is why discussion with the family is important, sir. Okay, so let's say they've expressed the wishes to the family, then the onus is on the family to come forward and say, yes, during the time of when he was alive, that he has expressed his wishes to donate his organ. We would like to carry out his wish, and the hospital and SOTO will be very glad to take this forward. And absolutely fine. So like I said, the donor card is just the expression of your wish that you want to donate your organs. It's more it becomes easy to have a conversation with your family if you have, actually expressed those wishes to your family.
Yeah.
Thank you. Thank you so much.
My query was, if one of our relative, coming this way, if I want to donate my organ to one of the relative, whether that also has to be channeled through that seniority list and all?
No. So in case of living donation, there's a living donation. So in case of living donation, no, you don't need to be on the waiting list. So that goes through a separate channel. So there, what happens is the government lawyer is there. There's a government committee which is held. So you come, we do a blood test on you. We do the blood test on your relative. Make sure that both of you are compatible. Once we find both of you are compatible, then we ask you to furnish a family tree to make sure, confirm that you guys are related. That thing has to be notarized by the Tahsildar. Then it will go to a police station. The police will come and check all your documents to make sure you guys are actually related. Then it will go to a government panel. The panel will invite both you and your potential recipient, ask you questions, make sure there's no any monetary transactions or any coercion involved in you wanting to donate. And if they are convinced that yes, there is no money involved, no money transaction involved, somebody is not pressurizing somebody to donate, they make sure that you are voluntarily donating your organ to your relative, then they will allow the donation to proceed. So usually this process will take anywhere between 3 weeks to 4 weeks time. And that is the only waiting period you need to do. You don't need to be on the waiting list.
Thank you very much. I had one more query. Shall I ask now only because I have time?
Go ahead. Please go ahead.
Can I specifically mention to what section of the society my organ should go? For example, poorest of the poor, it should be donated, because usually who can afford this sort of operation? Middle class, upper middle class are rich people only. So will it be possible? And whether poorer section of the society can afford this operation?
Okay, so we'll come to that question right now. Okay, so first of all, the answer is no. Directed donations are not allowed in India. Okay, so it's two sides of this one. So if at all you say, I want my organ to go to this particular person. Okay, now let us say I am rich. I need a transplant. I find out that there's a donor in this particular hospital. I will send a middleman to go tell the relative. You tell them that you want this organ to go to this person only, and I will pay you 5 lakh rupees. So directed donations are not legal in India. So that is why SOTO takes complete control, sir. There is a waiting list. Whoever is most deserving, whoever has been waiting for a long time, gets the organ. Now coming to the cost of transplant. Okay, yes, it is an expensive this one, but right now lot of families are there. Government of Karnataka in Bowring in Victoria Hospital is starting a transplant program where the cost of the transplant is 3 lakhs. Okay. Even in private hospitals, we have a lot of crowdfunding platforms right now. Keto, Millap, all these crowdfunding platforms are there. We do at least 10 to 15 transplants a year free of cost. How? Because we raise funds to the crowdfunding platforms. We have a patients come in with nothing, walk out after all the tests, walk out after a good liver transplant with money in their hand for all the post-op follow-up tests and medication. So money is never a criteria for organ transplant right now, sir, because lot of help is available. You can apply for the CM Relief Fund, PM Relief Fund. We apply to Ms. Sudha Murthy in Infosys, and money pours in, especially if you're from the economic weaker section. So because there is so much help available, the cost of that. So right now there are 26 transplant centers in Bangalore. Okay, so there are a lot of programs. All transplants are competitively priced, and trust me when I say this, money is never a barrier anymore to receive an organ transplant, because there are a lot of sources, and all hospitals have an in-house fundraising group who's only work over there. They're paid only to raise funds for transplant. So to answer your question, no, unfortunately, you cannot direct that I want my organ to go to this person only.
Yeah. Can we go to the next question?
Yeah.
Yeah. Kishorji is asking, can a beneficiary of organ transplant of heart or kidney pledge his or her heart kidney again to another beneficiary after his or her brain death? I think you've already answered.
Absolutely, sir. Absolutely. So, you know, you will not believe it. Most transplant patients are the most successful organ donors. We unfortunately have organ transplant patients dying because of one or the other complications, and they know the pain of being on a waiting list before they can actually receive an organ. And most of it, most if not all of our transplant patients usually pledge their organs. And yes, so let's say if you received a kidney, you can always pledge your other organs, liver, heart, lungs, everything you can pledge. And we also had a very interesting case when I was in Global Hospital. So this patient had a kidney transplant 13 years back. And unfortunately, he suffered a fall, suffered a stroke, and he was declared brain dead. Now that kidney, which was transplanted in him 13 years back, because it was so healthy, we were able to take out that kidney and put it in another person, and that kidney is still functioning. So yes, any organ transplant recipient, unless he does not have a communicable disease, can pledge his organ.
Shivani Kumar, I am 73 years old. I want to register my organs in case of brain death. I want to register for my body for medical studies and research. I want to follow my dad, late Honorary Captain Govind Raju, whose eyes and body was donated to St. John's Hospital 20 years ago.
Oh,
it was very tough to find a hospital to donate. Thanks for such a nice explanation. Thanks.
Okay, Ms. Shivani, first of all, thank you very much for your thought. You're 73 years young, okay? You're only good as your organs. And no, age is just a number, ma'am. You can always donate your organs. We have successfully transplanted a 86-year-old liver into a patient, and he's doing absolutely fine. Okay, so it all depends on the quality of your organs at the time of your demise. Okay, and yeah, please do get in touch with me personally. Mr. Rajkumar has my number. I'll be able to, you know, help you register in case, you know, after your death, if you want to register your body for medical research purposes. I'll be very happy to put you in touch with people who will do these things. And, you know, even that has a donor card. You just get a number and a card. And if your family goes and shows that number, the hospital will actually, you know, make sure your wishes come true for donating your body to this one. Yeah. Medical science. And it's a very, very, very noble thought. So incidentally, I am an alma mater of St. John's. And yes, we used to get a lot of patients coming and pledging their you know, bodies for medical science, and it's a very, very noble thing to do, Ms. Shivani. Thank you for that.
Good evening, doctor.
Yeah, good evening, sir. How are you?
Fine, thank you, doctor.
Thank you.
Okay. See, I'm diabetic, so but I can donate my organs, right?
Yes, you can. Yes, you can, sir.
Okay.
So
Okay.
There's
yeah.
Your follow-up question.
Please go ahead. Please go ahead. No, there's no follow-up.
At the time of your demise, so we'll obviously check for the quality of your organs, what your heart is doing, what your lungs are doing. If you're a smoker, obviously your lungs might not be suitable for donation. If you're diabetic over a long period of time, there is a chance that your kidneys might have gotten damaged. So it all depends on the quality of your organs at the time of your demise. Obviously, we do not want to transplant a bad organ into a recipient, right? So those are checks and balances available at that particular point of time. But 100%, like I said, go ahead and pledge your organs. So like I said, if you're not able to take your organs, your tissue, so let's say your heart is not feasible for donation, we can use your heart valves to use it for medical research. Your blood vessels, you can donate. You know, your eyes, you can donate. So absolutely, if not for organs, we can always do your tissues. And like I said, an organs will save 8 lives, whereas your tissues can save up to 75 lives. So please do pledge your organs, irrespective of what your medical condition is.
Yeah.
Okay. Another one, Dr. G. It's a little tricky.
Please.
My dad last year passed away from COVID.
Okay, I'm so sorry about that, sir.
No. I mean, sir, thank you so very much. He had that donation card with him.
Okay.
But you know, at that period of time, you don't think of that.
Yes.
You don't think. So I don't know whether it's right for the hospital to ask whether there's a donation card, something, so that we could have told them, please go.
Absolutely. So first thing, let me put your mind at rest. All across the world, anybody suffering from COVID cannot donate organs. Okay, because COVID spreads from person to people, and COVID was an absolute contraindication to actually donate organs. Okay,
thank you.
Yeah, so
thank you very
your
much.
Dad having the donor card, because he was suffering from COVID, unfortunately, he was not an eligible donor. Now, let's come to the second point. We were talking about lack of awareness. What was my first sentence? It's not only the public, even the medical personnel are not aware of the concept of organ donation. And that is where we have a long way to go to catch up with the West regarding organ donation being an actual question asked for everybody at admission. So in the US, when you sign a consent form, so when you get admitted, I'm fairly sure if you're admitted to a hospital, when you get admitted, they'll make you sign consent forms, no? So yes. One of the line in the US is, would you be willing to be an organ donor? Every time you went to a hospital, you had to sign whether you consented being an organ donor. So that's the level at which they are. You know, whereas we are still starting educating people about the concept of brain death and about the concept of organ donation. But, you know, God willing, I really think we will reach there one day. That every person, every hospital, every nursing home will ask this question: are you willing to be an organ donor in the unfortunate scenario that something bad happened?
Meanwhile, Dr. Suresh, I have one question.
Yeah.
Now,
suppose, please,
you said that if after death in the hospital, there is a possibility of this procedure starting for organ donation. Now, the family at that time, even though they have agreed for organ donation, they are also wanting to know how long this will take, because they would like to plan their, you know, whatever the funeral or cremation. Or
absolutely.
Sometimes
absolutely
they don't know how long it will take. So what is the procedure there?
Okay, so now, so this again becomes a roadblock for donation, sir. Okay, so I'll tell you the real scenario what we have. So patient has been in the hospital for 10 days. I know the patient's family has been counseled that, you know, he's quite sick. He might not make it. Over 10 days. And they're like, no, continue treatment, continue treatment, continue treatment. And one fine day, they come to acceptance that, yes, sir, is done. Okay, we are ready to donate organs and everything. But they say, okay, within 6 hours, you take the organs and give us the body because we want to plan a cremation. Okay. So this is a realistic scenario we get. Okay. Now the problem is, once you agree for donation, we need to first of all make sure that the patient is fit enough to donate. His blood tests have to be done. We need to make sure that all his organs are in a suitable state to donate and benefit other people. We need to make sure that he does not have any communicable diseases which can be, you know, sent to the, given to the recipient. We need to set in place the brain death testing protocol. Now, the brain death testing protocol itself takes 6 hours. Why? We need to do one test now, and we need to do one test 6 hours later. So now add 1 or 2 hours, plus or minus to Indian stretchable time, I call it IST. So let's say for brain death testing, it takes 8 hours time. So once we confirm that the patient is brain dead, only then are we legally allowed to test all the other tests. Got it? Because otherwise what happens? Unnecessary expense will add on. And if the family doesn't consent, then somebody has to bear the bill. So let's say 8 hours is gone in brain death testing and consenting. Then we get all these blood tests. Now let's say he's willing to donate his heart and lungs. So we need to do an echo to make sure his heart is functioning properly. We need to do something called as a bronchoscopy to make sure his lungs are okay. So let's add on another 2 to 3 hours for that to get those results. Now let's say, yes, we are totally fit. The patient is fit. This organ can be donated. We inform the government immediately. Okay. Now the government has to go through the list. Okay, heart is going to go to this person. Lung is going to go to this person. Liver is going to go to this person. Kidney is going to go to this person. They make a list. They send out the messages that you need to get ready. Your organ transplant is coming. Now, when it comes to the kidney, we want to make sure that it matches and that the recipient is not going to reject. Now, that results take 8 hours. Okay, so if the patient goes now and goes and gives his blood, the running the test takes 8 hours. Now, for the patient, he receives a phone call. He's in a state of panic. Oh my God, I got an organ, because he's waited 5 years. He needs to get ready, get a vehicle, Bangalore traffic. He needs to go to Domlore for TTK. So let's add on 2 hours for that. Give the blood, recipient donor's blood goes over that. The test takes 8 hours. So for cross matching, it takes 10 hours. Okay. So if you add on all of these things, it takes about 20 hours to actually proceed to the operating theater to procure the organs. So you're looking at 1 day minimum delay, sir. Okay. Or if it happens in the night, things go very quickly because traffic is less, communication is better, people come. Or let's say nobody is there for a heart transplant in Karnataka. So what happens? The heart gets allocated to Tamil Nadu.
Oh.
We need to wait for people to come from Tamil Nadu by flight, see what the commercial jet times are. So generally, when you agree for organ donation, you're looking at a delay of 1 day. So 24 hours, I think you need to this one. So that's how much it delays. And this 24 hours, believe it or not, is make or break for most people. Illa sir agala 24 ಗಂಟೆ ಆಗಲ್ಲ 2 ಗಂಟೆನಲ್ಲಿ ಪ್ಯಾಕ್ ಮಾಡಿ ಕೊಡಿ. They would have waited for 15 days. But the moment you say nothing is possible, and this is where the second rung of people, what I say, the immediate family is always okay with donation. Suddenly some uncle from somewhere, some neighbor from somewhere will come and say, hey, ಏನಕ್ಕೆ ಸುಮ್ಮನೆ ಇದೆಲ್ಲ ಮಾಡ್ತೀರಾ ಬನ್ನಿ ಕರ್ಕೊಂಡು ಹೋಗಿ ಬೆಳಗ್ಗೆ ಹೋಗಿ ಇದು ಮಾಡೋಣ. So that is the unfortunate thing that this happens. Yeah. But yeah, you're looking at a delay of 24 hours before you can actually plan for your last rites.
My first question, I'm repenting a lot now. I had my own child, cerebral palsy child who suffered and left the world at the age of 7. Okay. But I didn't have this kind of an awareness, you know, those days, whether I could devise or whatever.
It's the biggest roadblock right now to organ donation, ma'am.
Yes. And today, being a counseling psychologist, I really want to take up my next subject for this also. Yeah, and now I'm specialized for drug addiction and alcoholics in Bangalore. I work for NIMANS.
Very nice,
I want to know whether drug addicts can donate their organs.
Yes, absolutely.
That is opioids
yes.
and
provided
the severe drug addicts.
Yes, so they provided they
Healthy.
do not have any communicable diseases. So if at all you look at in the US with cadaveric donation, more than 50% of people who donate, young people who donate, are drug addicts. They always take an overdose of IV drugs, end up in a very bad state. And most people who donate in the US are usually drug overdoses. So as long as you do not have a communicable disease, 100% you are okay to donate.
Okay. And the last question, how many days can a patient wait for the organ receiving, you know, the recipient? How many days he can wait?
That is an unfortunate scenario, ma'am. So for kidney, it is good. Why? Because you have a treatment. You go on dialysis thrice a week.
Okay.
You're taken care of. You know, so people do end up waiting 5 years, 6 years, provided they do not have any other comorbidities like a heart patient, if he has asthma or everything. All of this complicates matters for him. So especially diabetes, you should not have. Diabetes and renal failure are a very bad combination. And you have more than 40% of patients who are diabetic and kidney failure die within 3 years on the waiting list. You know, the survival of a diabetic with kidney failure is worse than some cancers, actually, if you look at the survival curves. Now, for a liver, it is much more trickier because we do not have anything like dialysis for the liver. So it all depends on how sick you are. And right now in Bangalore, the waiting time based on your blood group will last anywhere between 4 months to a year or a year and a half even. You know, because of scarcity of donors, obviously. And in that meantime, if you're lucky enough, you know, healthy enough that you can sustain that kind of waiting period, you will get lucky and get an organ. But unfortunately, when it comes to liver failure, we lose a lot of patients just waiting to receive the gift of life, unfortunately.
Okay. Thank you so much, sir. Thank you very much.
Don't even ask about heart and lung because we do not have support systems for heart and lung. And, you know, their survival on the waiting list is very dismal if they don't get an early transplant.
Okay. Thank you.
Thank you, Ms. Aparna, for your questions.
Yeah. Anybody else? Any questions? We'll close because Dr. Suresh, I think you have spent almost 1.5 to 2 hours with us.
No, it's been a pleasure, Mr. Rajkumar. It's been a pleasure.
I have one more question, one last question in case somebody does not have. This is a very strange question for you because you have been, you know, opening up bodies, removing organs from one, putting it in another one. You've been doing all this.
Right.
As a layman, I want to know, because you've been doing this, I want to know what are the 3 or 4 simple advices that you can give us to make sure that we lead a healthier life in terms of not the usual, you know, walk and exercise and diet, because you've been dealing with these organs. I mean, what would be the insight that we can get from you?
Inside, sir, I'll tell you, you never know when you're going to die. That is what I've learned operating on so many donors.
Yes.
Nobody wants to die, obviously. You have very healthy people just dropping that. Young 20-year-old kids, all he wanted to do was a joyride on the bike, and he ends up becoming a donor. It is very sad. Looking at donor stories is probably the worst thing. You have a family of 6 going in a car. 4 people died. The breadwinner of the family has a head injury and he is lying in the ICU. And the 6th will usually be the wife or whatever who's alive. And she has to take a difficult decision of donating her husband's organs. These are heart-wrenching scenarios, sir. Okay. So my advice is live life for the fullest. Okay. You never know when your last date is going to be. Okay. Having said that, take care of yourself, be happy with others, help each other. What C4C is doing, looking at the greater good of the community. I really think helping others will keep you much more healthier. More important here, the physical health. Yes, you can exercise, like you said, exercise, eat healthy, all of that will be physically fit. But in this day and age of COVID, being cooped up, being forced to, be the thing, I would say concentrate on your mental fitness more than your physical fitness. I hope that kind of answers your question.
Yeah, definitely. I mean, you hit it when you said that when you help others, you're going to be happy, and that's the life we all want.
Absolutely, sir.
So
Absolutely.
I would like to thank you from my side, and I request
thank you, Mr.
Tasneem to do the honors of thanking. It was really a wonderful session, and frankly,
thank you, sir.
I have been myself working with a lot of hospitals and doctors, but today's session has been an eye-opener for me personally.
Thank you, sir. That's a honor. Thank you very much.
Absolutely. I actually have a question before I conclude. May I just ask one?
Yeah, sure.
So I just wanted to know, we've been talking about all this happening at a hospital. So where, all these testing and doctors are available, but when there's a death at home, a sudden death at home, and how do we donate when that happens? I mean,
so there are various organizations. So easiest would be Lions Club, Rotary Club. All these places have specified helpline numbers. Okay. You just contact those helpline numbers, especially so if there's a death in the family at home, unfortunately, you will not be able to transplant those organs. Because you want the heart to be beating at the time of procuring. Okay. So, but yes, you can donate your eyes, you can donate the body to medical science, you can donate skin, you can donate bone. So most Jiva Sarthakate will be the best possible resource, man. Okay. The SOTO, what I said, no? You go on to SOTO, there's a 24/7, there are 8 coordinators whose only job is to promote organ donation and kind of regularize all of this and coordinate all the different parts of the wheel when it comes to organ donation. You call up that helpline, it is manned 24/7. When it comes to organ donation, body donation, they will coordinate everything for you. You do not have to, be tensed or be worked up at such a difficult time. It's just a phone call away. Everything will be set into motion. SOTO will take over and facilitate everything. They've done a wonderful job. Hats off to the government of Karnataka for being so proactive towards organ donation. We've done extremely well. We are actually in the top 3, I would say, in India when it comes to the number of deceased donor donations.
So I'm sure this program can go on and on. Like we can't stop asking questions, and it has personally been very overwhelming for me personally because so many possibilities to save so many lives. So
absolutely.
Thank you so much for that wonderful talk, Dr. Suresh. One good outcome I see will be when someone is going to have a better life because someone donated an organ, and that someone learned how to go about it from today's program.
Yes.
So this is bound to happen considering the kind of people that have been part of this conversation today. And for making this possible on behalf of myself, all C4C members and all attendees of today's program, I heartily thank Dr. Suresh Raghavaiah, who has been kind enough to take time out and explain so many aspects of organ donation to us today. I also thank all of you, the participants, for having made this a useful program by attending and asking for your questions and for your comments. To conclude, I would like to say, let us all start thinking out of the box about trying to help improve quality of life for others. Because when we know we are improving someone else's life, that knowledge brings us happiness, and happiness is definitely our ultimate goal. So thank you one and all. Stay safe, stay healthy, and donate healthy organs to others when you donate.
Yeah.
Need them anymore, when you don't need them anymore. So good night, Shabba Khair. Thank you.
Thank you, Dr.
Thank you, Suresh. So, I'd like to end by saying the Indian poll showed that 80% of them were aware of organ donation, but only 3% of them signed up to be organ donors. So I'm hoping at the end of this session, we will be in the 3% and not in the 80%.
We will raise the 3%.
Thank you, Mr. Rajkumar. Again, it's been such a honor being a part of this thing. And like I said, it is a subject which is close to my heart. And I really thank Mr. Rajkumar, Tasneem, and C4C for giving me this opportunity to speak at the forum. So it's been a great pleasure interacting with you, and looking forward to many more such sessions in the future.
Sure. Thank you so much.
Best of luck to everybody. Have a good night, sir.